Hey guys, what's going on? My name is Abhinav. I'm a first year medical student, and today I want to go through a case study about some topics that I've been learning about in school. Today I want to go over some of the venous drainage systems in the abdomen. And just before I forget, please do subscribe and like this video. It helps me out a ton and lets me know if you still want to learn more about content that I'm learning in medical school. So without any further ado, let's get into this case study. This case study will focus a lot on drainage of the blood from the abdomen and where it goes into the liver, as well as a case about a disease called Caput Medusae. And here we go. So the case study here, I have it listed out here. A patient comes into the emergency room with stomach pains, and this is his chief complaint. His liver protrudes from the abdomen when you examine the abdomen, and you see signs of enlarged superficial veins throughout his chest. So there's just like veins coming out, protruding from his chest, which are very visible, which shouldn't really be happening. And you conclude and diagnose it with him with a disease called Caput Medusae. Sometimes you see it with the E over here, sometimes you don't, but it's just like Medusa, and I think of like Medusa, like the mythological creature that turns people into stone when you look at her. So the case study here asks for what's its anatomical origin, describe the venous system anastomoses in relation to the portal vein, as well as any other symptoms that this patient might be having. And this will come a little bit more clear as we go through. Before we get into all the anatomy here, I just want to show a quick picture about Caput Medusae, and please do be careful if you are wary of weird medical things. But here is a picture of the Caput Medusae. Here is the anatomy that we'll be going through. But here's a picture of the Caput Medusae. This is very mild, but you see that there's some superficial veins that kind of pop out at you, and these should not be happening. This is from healthline.com, so I'll put a link down in below. I'll put all my sources down below in case you want to explore it a little further. But this website does kind of outline what Caput Medusae is in terms of managing it and diagnosing it and like, treating it and all that. But today I just want to go over the anatomy of it. So when we get into the anatomy of it, we ultimately need to look into the venous drainage system in the abdomen. Now, all blood from your intestines, your stomach, your colon, everything goes to the liver first. And this is because the liver needs to detoxify anything that you might have eaten. And then that blood will go to the heart. And this is one of the few portal systems in your body. The portal systems just mean that blood is going to there instead of the heart. When you think of veins, you think of blood going from the organ to the heart. Portal system is kind of a mid-stop where the blood goes from the organ to the portal system, drains into the organ of the portal system, and then recirculates back into more veins that will eventually go to the heart. Another example of this is in the brain with your hormones, and there is a portal system there as well. So when we look at the venous system here, we see that the endpoint is this portal vein. This portal vein drains all the blood. These are all veins coming from the gastric, duodenal intestines, all that, into, and it's going into the liver here. You see the liver is reflected, and you see the gallbladder right here. Now, the gallbladder is not too important in this situation, but what happens with Caput Medusae, and the reason why there's distended blood vessels, is because there is a blockage of the portal vein here. So let's say that the portal vein has an obstruction, like right around here, right before it gets introduced, the blood gets introduced into the liver. Well, what happens there is that blood is now backed up. Blood needs to get to the heart, and the only way it does that is actually through anastomoses. Anastomoses just means a reroute, a passageway that reroutes blood in case there's a blockage in the main path. So there's actually a lot of anastomoses here. So let's first review the venous systems in the abdomen. There's the superior mesenteric vein, the inferior mesenteric vein, and the splenic vein here. There's also, not labeled here, is the left gastric vein. The left gastric vein drains blood from the stomach, the lesser curvature of the stomach, into the portal vein. The splenic vein drains blood from the spleen, the pancreas, the duodenum, and to the portal vein. The inferior mesenteric and the superior mesenteric drain blood from the duodenum, jejunum, ileum, which are the three parts of the small intestine, as well as the large intestine, the colon. All that blood goes into the superior and inferior mesenteric, which eventually all branch through into the portal vein, and the portal vein goes to the liver. So if you have a blockage right here, that means that blood needs to go the opposite way to get to the inferior vena cava. The inferior vena cava is the ultimate destination. After this portal vein, normally blood will go to the hepatic vein, which will then go into the inferior vena cava. Instead of that, the blood will actually go the opposite way. So what happens from order of most importance to least importance clinically is that blood will go first into the gastric veins right here. So it goes, instead of the left gastric rerouting blood this way into the portal vein, it actually goes the opposite way now because it needs to get to the inferior vena cava. The way it does that, it goes through here, and actually these, there is an anastomosis with the esophagus here, and there are blood vessels that go up the esophagus, and then the esophageal veins go into the inferior vena cava eventually. And the thing about that is that the blood veins there are very thin. They're not used to carrying that much blood. If you imagine all this intestinal and abdominal blood going to that area and up the esophagus in the esophageal veins is not normal. So there's going to be very distended blood vessels there, and they are prone for rupturing. So that's one way you can go up, through the esophagus. The other way is it goes back through the splenic, goes back through the inferior mesenteric, goes back through the superior mesenteric. So there are 4 different ways. The superior and inferior mesenteric, they might go into the back of the body wall and then go up the body wall that way. The splenic, they might go into abdominal wall blood vessels. So those are the multiple ways that blood can go back and avoid the portal vein system. And normally this doesn't happen even though there are anastomoses that go to the inferior vena cava, diverging away from the portal vein. Usually the blood pressure and the way of natural flow all contribute towards blood going towards the portal vein. Going the other way is not natural, but they are there for emergencies. The body has evolved a way to account for possible occlusions in the portal vein. And so the reason why we're seeing the symptoms of Caput Medusae, where blood vessels are distended in the abdomen, are that the blood is being rerouted to superficial and more weaker veins, some not superficial like the esophageal veins. So what we see is that the blood is going the opposite way and it's distending those blood vessels. I talked about the splenic vein and the superior and inferior mesenteric. So all those veins drain into smaller veins outside the abdomen cavity, and they appear as distended superficially. And that's why you can see those crazy veins on the surface of the body. And the other question here is that what other symptoms could be possible here? And the other symptoms that can be possible here is actually related to this left gastric vein that I was talking about and how it goes up the esophagus. If it goes up the esophagus, and those blood vessels are extremely dilated and full of blood, they are prone to rupture. So if you swallow something, something not even that big, depends on how severe the case is, but if you swallow something and the food, the bolus ruptures the veins here, that can lead to bleeding inside the esophagus. And what can lead is that the patient might be coughing up blood. And if they cough up blood, that's a real sign that they're in trouble and they need to be sent to surgery somehow because they need to have those veins repaired, or else they can lose a lot of blood through internal bleeding and they could die out. So that's a very severe case of Caput Medusae. And when I showed you the picture here, that is a very concerning symptom that a patient can present with, but it can lead to a lot of different severities. I've seen some pictures where the entire abdomen here and even veins up the thorax was distended, and that's very scary. So that's a little bit about the disease Caput Medusae and the portal vein system in the abdomen, drainage system in the abdomen. This is a major part of blood traveling in the body because this is where all your nutrients come from. The blood here is not oxygenated that much because it's already delivered its oxygen to the organs, but it is rich in nutrients, everything except fat, which primarily travels through lymph. So, with that being said, that's about it. That's the case of Caput Medusae. And here's the case one more time if you want to look it over. But please do let me know what you think about this topic. I would love to hear any improvements that I can make. And if anything I missed, please do let me know in the comments down below. And again, please do subscribe and like. And I look forward to sharing more medical knowledge with you guys in the future. With that being said, thanks. Have a good one.